Coming up, we'll be on location at the Capital Interventional Pain and Spine Center in Rockville, Maryland, discussing the latest advances in pain management and how these treatments can help minimize and even eliminate pain and restore your active and healthy lifestyle with one of this area's top doctors, Dr. Akshay Garg. Welcome, Dr. Garg, to the Top Doctors Interviews program.
Thanks so much for having me, Nicholas.
Oh, it's a pleasure. We're going to get into the advances in pain management and interventional pain medicine shortly, but I wanted to talk briefly about your new practice here that you've set up here in Rockville, Maryland. First of all, you're recognized as a top doctor by Washingtonian Magazine, as well as many other organizations throughout the DMV region. You've established a reputation for excellence in patient care, as well as pain medicine. And I wanted to ask you, with this great new state-of-the-art practice here in Rockville, what was your vision for this practice?
Sure. No, that's a great question. And thanks so much again for having me, Nicholas. You know, when I opened this practice earlier this year, the vision was simple. I wanted it to be a very patient-centric practice, meaning what can we do to help restore function for folks, right? What can we do to help improve their quality of life by decreasing whatever pain is limiting them? And so with that goal in mind, you know, we've really been able to help the community right where I've grown up. You know, my background is in physical medicine and rehab. So prior to completing an interventional pain fellowship, we did a residency to become a physiatrist, and what that involves is learning how to help folks who unfortunately suffer from different impairments and disabilities. So when we have a new patient come in, it's super important for us to figure out those goals and try to take a different approach to figure out how we can help them.
There's different types of treatment options. There's different ways to treat pain, and so many people suffer from different types of pain, whether it's from an accident or just back pain or neck pain or various types of pain. Can you please begin, Dr. Garg, by telling us what interventional pain medicine is?
Sure. No, that's a great question. It's a field within pain management itself where we're using very minimally invasive procedures to intervene and disrupt the pain signal so that patients feel better, they can get back to exercising, do the things they like to do and need to do. And it's a really exciting time to be an interventional pain physician because just within the past decades, there have been an enormous amount of new procedures that have come out, all evidence-based, that we've been able to do for patients that provide them long-term relief. And that's really the goal, you know, looking at patients from a big picture standpoint to see what can we help you with now and how will this help you years down the road.
That sounds great. And, you know, surgery should always be the last resort. So the fact that it's non-invasive is really beneficial for patients.
You know, surgery is something we always discuss with patients, but of course, invasive surgeries don't always help. And in the past, it's been one of those things where, you know, we would try medications, try therapy, and even the interventional options were last resort. But now we're slowly finding that for certain patients, if they're adopted early enough, they may even help folks not require medications or wean off of their medications or get more bang for their buck with their physical therapy and home exercises. And like you mentioned, maybe avoid surgery entirely. And so some of those procedures that we do can be something as simple as a steroid injection, which has been around for decades and decades. We're able to target the specific nerves that are the problem by either ablating them or stimulating them. So using drug-free ways to help folks. And some of the newer things that have come out that are very exciting are the biologics, kind of the regenerative medicine, you know, the stem cells and platelet-rich plasma, everything you hear that the athletes are getting now, we're able to offer for patients too who suffer from different joint or tendon or ligament injuries. So it's a really exciting time.
What types of problems can be addressed through interventional pain medicine?
Several. Here we treat a majority of spine-related conditions, so neck, mid-back, low back. But along with that, we're able to target joint pains, knees, shoulders, elbows, hips, and also tendon, ligament injuries, so our sports patients, our athletes, young or old, our weekend warriors. We're really able to kind of help you from head to toe, you know, and it all starts with that initial consult visit where we sit down, do a full examination, review all your records, review all your imaging, order any imaging if we need it, and really go A to Z to say, hey, this is what we think is going on, this is what we think we can do, this is what you should expect, and if this doesn't work, these will be options B, C, D, and E. So the patients are always involved, right? And I love it when patients are advocates for themselves, so they know exactly what's going on, because it's their body, right? They should know what they're going up against.
Well, you're truly a patient-centric practice. That means you take the time for each patient that's necessary to correctly identify or diagnose them for whatever's ailing them. Because you have these many practices where they don't really give the patients the time anymore. So to have someone like you with this focus on patient care is really refreshing and great for the patients.
No, thank you. Yeah, I've been on the other side as a patient, and so I've seen both sides of it. And when you're in chronic pain, it affects not only you, it affects your spouse, your kids, your family. And so it's a big compliment to us when patients come in and are willing to put their trust in us to be able to help them.
You have a beautiful state-of-the-art practice, again, here in Rockville, Maryland, and you see patients throughout Maryland, D.C., Northern Virginia, the whole DMV region. Are the procedures performed here at your practice, Dr. Garg, or are they performed in a hospital? How does that work?
When I opened this practice up, I really wanted to keep everything in-house, and it was really for patient convenience, right? We try to do everything under one roof. At my prior employment, patients had to go to a surgery center or to a hospital. It would be confusing. There's additional fees that they have to pay. So being able to do everything under one roof is very nice. And sometimes we're able to do these same day for folks too. So luckily we can do everything right here in one place.
Well, the patients love it. We spoke to some of your patients and they just raved about your focus on them, how you really care for them, you give them the time, and the amazing results that they've been getting as well.
Yeah, we've been very fortunate to just have such great patients who are excellent with their follow-ups. And again, I think it just comes down to setting the expectations, right? And during that initial visit, that's really what we spend a lot of time on, because with chronic pain, it can overpower you. And so what we're trying to do during those visits is give them that education to give them the power back, right? And if they're a good candidate for a procedure, happy to do it. Not everybody needs one. And I think that's where that education is so important. So they know exactly what's going on.
Yeah, one of the main common themes that we heard from your patients is that you really care about them and do what's best for them, not unlike some practices that do what's best for their bottom line.
Yeah, everybody should have an individualized plan. Just because someone has the same findings on their MRI doesn't mean they need the exact same treatment. One person's goal may be very different from someone else's. One person may want to be able to simply walk around the block with their wife. One person may want to be able to go run a marathon. So I think once we have the goals established, it becomes a lot easier to work with the patients.
And how are some of these procedures performed?
So we do everything under image guidance. And what I mean by that is, we have a state-of-the-art X-ray machine in the office. We have an ultrasound machine in the office. And so what's really revolutionized pain management, or interventional pain management, is being able to see the problem. And then when you're doing the procedure, see the needle, see the instruments, whatever you're using, so you can accurately target the pain. And so that does two things. One, it's safer, right? Number one, it's much safer for the patients. And two, the results are better because you can actually see where you're going. And it's great, patients are awake for these, they're comfortable. Many of my patients like to look up and see the X-ray as we're doing it, and I'm explaining it to them, and they love it, so everything is done under image guidance here.
And how many treatment sessions are typically necessary for your patients to recover?
So it varies. It depends on what you're treating. So here we see folks as young as 18 all the way up to people in their 90s. And so for our younger athletes, weekend warriors, some of the procedures we do that may involve a simple injection or the biologic injections, sometimes they get one and they're okay. Sometimes they need a repeat one, if it's indicated. And same for our older population, they may be suffering from more degenerative issues, spinal stenosis, sciatica, these types of things. And so the procedures we're able to offer now where we can specifically target the nerve and stimulate it or ablate it, those can last for years. So patients sometimes need a tune-up in between, if you will, but we try to do as little as possible. And in this field, I think less is more sometimes.
Yeah, and that's the key, is you want to make sure they get the best results without having to do the worst case scenarios of surgery and things that should always be last resort.
Right.
So, regenerative medicine is something that's really catching on. It's very cutting edge. It really has so many benefits, Dr. Garg. Can you tell us a little bit about PRP and some of the other benefits of regenerative medicine and how it works?
Yeah, no, that's a great question. So PRP, or platelet-rich plasma, is a technique where we actually take your blood, spin it down, and we take out the growth factors, the healing factors from that portion of your blood. And these are the normal factors that your body uses to heal itself anyways from any injury. So what we're doing is taking those growth factors and injecting them back into the painful part to signal to your brain that, hey, we need to work on this. Something's going on. Let's send the units over there to try to recover and heal this part of the body. So it's really been a game changer for us, because prior to this, a majority of what we were doing were a lot of steroid injections, and those are still great for certain patients, but for patients in whom they can't have steroids or they've had them already and it didn't work, PRP has shown for specific diagnoses to work just as well, if not better, than the steroids. So it's been a great alternative for folks, and we do that right in the office too, under image guidance. So we make sure we get right to the place.
And it's natural, it's part of your own body, your own blood, your own platelets.
Yeah, there's nothing added. It's all what you already have within. We're just using it to give your body a boost so you can start to heal faster. And we always couple it with exercises, physical therapy, because doing an injection is easy, right? But it's really the follow-up and what you're doing on your end to make this shot last longer is where it counts. So, we always stress to the patients, especially after PRP, that look, the material's in there, everything is good, but now you have to do the hard work of rehabbing that knee or rehabbing that shoulder. And if they do that, the results have been phenomenal.
Because it's really a partnership with the patient, and you're really working with the patient and educating them so they understand what's going on with the treatment and what they need to do to get those best outcomes. Right?
Yeah, absolutely. I think education is the best thing you can do for any patient. Whether or not we do a treatment, so long as they know what's going on, what the problem is, I think they feel better.
And again, that comes down to sitting down with the patient, taking the time with the patient, which again is so rare nowadays. It's really great that you're doing that. You're really taking the time with each patient to understand what they're going through and to put together the best treatment plan.
I've been lucky to train with, some of the best and the brightest in pain management, and, learning the advanced techniques is great, but I think the biggest thing is when should you do it and when should you not do it? And for me, it's kind of old school, but if I wouldn't do it for my mom, I don't want to do it for you, right? If she won't benefit from it and I don't feel comfortable doing it for her, knowing it's not a good idea, I'm not going to push it on you either.
Well, I love that approach. I mean, that's truly patient care at the highest level. What is the typical downtime from these treatments and procedures?
So we're very lucky in this field. Because the procedures are so minimally invasive, patients go home the same day. The procedures can take anywhere from 5 to 20 minutes to do. Folks usually take it easy that day, but by the next day I tell them get back in your normal groove of things and we'll see them in a couple of weeks. So really little to no downtime.
That's wonderful. So they don't really have to miss a lot of work, or they can get back to their life and their normal activities.
Yeah, and that's the goal. Of course, the goal is to reduce your pain, but I think the focus needs to shift to, are you able to function better? Are you able to do the things you like to do? Are you able to do the things you need to do? And so people who still have a little bit of pain afterwards, but they're able to do those things, are very content.
And how long do these results last, Dr. Garg? Are they something that's permanent, or do they have to come back for more treatments?
Some procedures that we do may need to be repeated. Some procedures that we do can last for years and years and years. And so I think the important thing to keep in mind is the bigger picture, meaning me reducing your pain is just one part of the puzzle, right? How are you sleeping? How are you eating? What are you doing for your diet? What are you doing for your stress? What are you doing for your core strength? So pain is so multifactorial. You have to attack it from all of these different angles. And those are things that we try to discuss on the visit too, because we have to rely on our colleagues to help with some of those things. So being in touch with their primary care docs, being in touch with their neurologists, being in touch with their therapist or their nutritionist, if we're all on the same page, then that's what can lead to the best outcomes. So, me being able to be an important part of it is very humbling to me, because oftentimes pain's the limiting factor. I can't sleep because it hurts. I can't work out because it hurts. And so if I can reduce that, then it's a very rewarding experience.
Well, you're doing great work. You've helped so many people regain their lives, brought joy back to their lives, because pain can be so debilitating, as we all know. And I want to thank you, Dr. Garg, for joining us today and being a guest on the program.
No, thanks so much for having me, Nicholas. It's been great.
I had a disc surgery, a laminectomy, in February of 2021. The pain should have subsided substantially after that procedure, but it did not. So I went back to one of Dr. Garg's colleagues at GW Hospital, a neurologist, and told her what was happening with me. And she said, let me refer you to my colleague, Dr. Garg, and I think you should see him, which is what I did. My first visit with him, I immediately felt that he and I were in sync, because he knew a lot about some traditional, not only the traditional, but some non-traditional approaches to pain management, and I was pleased with that. The diagnostic process was the most complete that I had ever gone through before. I like to tell people that he MRI'd me from head to toe. And we also went to another colleague of his to do some EMGs, that's the testing of the nerves. And as a result of that, Dr. Garg was able to figure out an approach. Then he presented me with the option of a spinal cord stimulator implant. And I said, okay, I'm game. We've tried everything else. Let's go for it. The results were really, really surprisingly good. I was amazed at how quick I began to get relief. Movement had always been a challenge for me with managing the pain. And so the fact that I was able to gradually build up the number of steps that I could take on a regular basis, because I do wear a Fitbit, so I keep track of those things. And I was very, very excited about being able to get to 3,500 steps, then 6,000, then 7. On some days I could get up to 8,000 steps a day. So to me, that was an important sign that things are back to where we hoped they would be. He's easy to communicate with. He's straightforward. And I think those two things are as a result of Dr. Garg is a great listener. He pays attention, he assesses what I, as his patient, is saying, but what's most important is that communication. I've had the utmost exceptionally positive experience with Dr. Garg.
My pain was so serious that I thought I really had no choice left other than surgery. I really wanted to avoid that. I'd been to so many doctors and done so many procedures, and nothing worked. Nothing worked for long, for sure. And so Dr. Garg was kind of my last option. Somebody had recommended him to me. And as anybody who's lived with chronic severe pain knows, it was like a knife in various parts of my body 24/7. So every day, every night. So it was severe pain and really not wanting to do the surgery that brought me to Dr. Garg. So one of the most important things I think Dr. Garg did was spend the time before I got procedures to diagnose me, to properly diagnose me. He did tests that now I realize are common sense, but no other doctor had done them. So for instance, I thought I had sciatica, but it wasn't sciatica, it was an inflamed bursa nerve. So by merely injecting it with some cortisone, that knife in that part of my body went away immediately. With Dr. Garg properly diagnosing me and coming up with not just a treatment plan that's best for his practice, but a treatment plan that's best for me, I was able to alleviate that chronic pain through simple follow-up with his team and the plan that we've produced that is focused not on what's best for his practice, but what's on best for me. The results were literally life-changing for me. And I know if I heard that, I would be skeptical. I had gone to so many doctors that I had heard were life-changing, or they had procedures that were quick fixes or whatnot, and none of them worked. Dr. Garg's interventions and the treatment plan was truly life-changing. My chronic pain in my back has subsided, and in some cases has completely gone away. So you're able to take your life back. He really focuses on the patient, and not just taking time to understand you as a patient, but you as a person. And that allows you to get back the life that you want to live.
Back in 2020, I had this injury on my back when I was at work. And first I was diagnosed to have just muscle strain, did physical therapy, went back to work, like nothing happened. One day I was lifting fluids, I would say 5 liter fluids, and then all of a sudden I just had this really excruciating pain. I was crying, couldn't get up, couldn't walk. And they had to wheel me to the emergency room. And they found out I had a herniated disc. It impacted many avenues, many aspects of my life. First, I had to give up my job as an ICU nurse. I had to step back. That was really devastating for me. It affected my relationship with my family and my friends. I don't think it's the way to live a life, being in pain, crying every single day. And I just needed help. Without the management of the pain, I couldn't do physical therapy. They did tell me, go ahead and have TENS therapy. Didn't work. And then with pain medication too, opioid, but I couldn't really take it that much, so I had to resort to different kinds of medications that Dr. Garg helped me to sort out. And of course, the epidural steroid treatment, which I think really worked the best for me. As you see right now, I am functional. I am happier to be able to walk long distances, to sit down and just for long hours and have fun, go back to what I used to do. And now actually I'm going back to, exercising and more of a back to yoga, back to my Pilates or whatever, but this is the way to live a life. And what really stood out is him having a heart to listen to what I have to say and to help me through it all. And I think that is the key for me to, hey, I'm staying with him. So I recommend for you to go to Dr. Garg because he's an expert, bar none. It is not just the skill set, it's not just the knowledge, not that he graduated from these top schools and all the letters behind his name, but also when somebody treats you, the humanity and just working with you, listening to you, and that will make somebody stand out from the sea of experts. And that is coming from me, who works in a health profession for 28 years.